Okay. Hi, I'm Lynn Dennis, and I am a licensed child care home provider. I have been doing home daycare for 33 years, and I'm licensed for 12 kids. And this is all I've known for 30 years of my life. I've been married for 32 years, and I have two girls. They're 22 and 25. So my job was amazing when my kids were little, and now that they're grown, I still love it. So I stayed.
Awesome. Well, thank you so much. Okay, Rhonda, let's try your audio one more time. I still am not hearing you. And it's just hers, it seems like.
She's got headphones on.
Yeah, it could be something with the headset.
I'm thinking it's that.
Okay.
She probably needs to unplug that or change her.
Yeah, because it's
She's
saying
still
she's muted.
talking.
Yeah, and it's saying she's muted. There's not.
No, she's not muted. You don't have her muted.
And I'm looking at Raquel. Okay, let's come back. Go ahead and try and work on your audio since you are presenting. And hopefully, hopefully it gets straightened out and worked out. But we'll go ahead and move on for now and just get some quick updates in because we do have a pretty full agenda. Raquel, since you are here and Beth is not, do you mind going ahead and giving us some updates from the Early Childhood Coalition?
Well, I would be happy to. I'm afraid the last coalition meeting I was traveling for Region 9 at a conference. But we're we're always busy with our different collaborative teams with the Early Childhood Coalition. We were going to have a opportunity in the fall that didn't work out to really expand our reach and just make sure that other organizations that want to join and participate. We feel that it's always a good thing to expand our base and the stakeholders and relationships that we have with the Early Childhood Coalition. So that is something that we're hoping to do something in the spring. Actually, in March, we'll have an evening meeting and it will kick off Child Abuse Awareness Month in April. So we will have an event in March. And I was just looking real quick to see if I have that date for the evening. So that will be March the 24th from 5:30 to 7:30. That's the date at the present moment. Location to be determined. And again, that's kickoff for all the things that are happening in April with ACEs awareness. So really a continued focus on adverse childhood experiences and how that impacts our young children, their families, and the communities that we all serve. So that's kind of it in a nutshell. Beth would probably do a more awesome, a more awesome job. But that's what I have, and happy to answer any questions if I can.
If there's no questions, I did want to say if anyone is interested in being a part of the Early Childhood Coalition, please put your email in the chat. That way I can hand it off to Beth and you can get all of the updated events that are going around in our community and any participation with the Early Childhood Coalition. They do a whole lot of really great stuff. I do have a couple of events that they are having soon on October 28th. There's going to be a trunk or treat at the Community Healthcare Center. It starts at 6 p.m. So if you or your kiddos, any of you daycare owners have, parents who don't have any plans for that evening, go ahead and go out there. It says while supplies last, and I'm sure it's going to be a great time. So that's there. And then this Thursday, there is a ribbon cutting for the Heart Gallery at the airport. And I can send out more information on that. There's a long list of things that they're going to be doing there. Tim Short's going to be there. And so that's also a really neat. And I do believe that this is an adoption type related event. So if you find yourself with nothing to do on Thursday, head out there, get a kind of taste for what's happening there. Nikki Davis was supposed to be here today. She just texted me and told me that she could not make it, but we did have a TACY chapter meeting yesterday. And we connected with one of the TACY chapter leaders from Fort Worth, who was a really great meeting, lasted quite a long time because we had a lot of questions. There were a lot of details. There has been some overturn in some of the people who are in charge of the TACY chapter for our area. And so we haven't had a whole lot of communication with them lately. We did get some great feedback though from Rebecca Rueda, who is a part of the Fort Worth chapter, to talk about like things that we can do in our community while we're kind of waiting. And we're still a provisional chapter, so we're still waiting until we get the go ahead. But again, there's been overturn in employment there and whatnot. So we're going to be trying to communicate with them as much as possible. But in the meantime, we are going to be partnering with different chapters, the Denton chapter and the Fort Worth chapter, just to kind of get our feet off the ground and make some really good connections and hopefully, intercorrelate all of our, early childhood coalitions and this council and TACY. And hopefully at some point we will know more and we will have events coming up. So yesterday we got some information. I will keep y'all updated on anything else that we hear in the next couple of weeks. And then as far as that goes, if you have anybody who is interested in sitting in one of these committee meetings to give any information, any updates about what's going on in the community that we might not touch on in these meetings or in early childhood coalition meetings, I know that everybody is extremely busy and we have our hands in so many different pots. But if anybody comes to any of you and says, hey, I have some information to share regarding early childhood education in our committee, I would absolutely love for you to share their email and information with me so I can invite them and they can do some kind of short presentation, just give us more background information. The more we can do, the better it's going to be for our kiddos. So I'm going to see, Rhonda, are you working yet?
I think I have it fixed. Can y'all hear me?
Good deal.
I apologize. We do everything in agency through Teams, and I haven't been on a Zoom meeting in probably 6 months. And they made me download a app from my desktop. It's a thing, but
Yeah.
I think I got it sorted. But I am so glad I sent you the presentation because I have no idea how to share it right now.
Let me see here. 1 second.
Anyway. I am Rhonda McClung. I am a child care navigator with Child Care Regulation. I also want to note that one of my coworkers, Carolyn Rodriguez, is also on the call, although I don't think she jumped in to introduce herself, but she was having the same problem getting on Zoom with me. Just to give y'all, while she's pulling up the presentation, y'all may have heard of the navigators previously to this, and some of you may know Elizabeth Barker. She was previously the navigator for Region 4. She's now our unit supervisor. We just recently transitioned from being contractors with Health and Human Services to being actual employees with Child Care Regulation. So we were very excited about that. I was, because I was former CCR inspector and everything else. So I was like, yay, I get to go back to state service. But we now have, Liz is our supervisor, as I said. There's 7 of us across the state, and we've divvied up our regions according to responsibility. So that'll something we'll cover in a little further detail. Can you start the presentation, Kayla?
I think she was trying to get you to share.
Gotcha. Okay. Yeah. Give me just 1 second. I got to pull that up real quick.
I got you. I know how to share on Teams, but don't ask me how to do it on Zoom because
you're fine.
And we're going to be doing this a lot with TWC, with the Child Care Advisory Councils across the state as well. So I guess we all better learn, the navigators better learn how to do this. But just so y'all know, I'm actually located in Amarillo. So I'm way across the state from y'all, which is why I didn't get to come in person. but excited to do Region 4. I get all the rural areas. That's what Liz told me when she told me the reassignments. I get Region 1, which is Amarillo, Lubbock, 2, which is Abilene, Wichita Falls, 9, which is Midland, Odessa, and El Paso, Region 10, as well as East Texas, which I'm like, hope you don't expect me to travel because that's a lot.
I understand completely. We're just glad that you're here today.
Oh, I'm glad to be here.
Okay, let me pull this up here. Can you all see that?
I can, yes.
Okay, perfect. All right, so I will let you go ahead and you just tell me when you want me to switch slides.
Okay. The Child Care Regulation Navigators, our positions were created in November of 2022, initially with some of the grant money that was made available with the pandemic funds, with the sole purpose of trying to increase the number of child care facilities in the state of Texas, especially since we lost so many during the pandemic. So if you'll go to the next slide. Of the original batch, myself, Liz, and Cynthia Vela are the only ones that started in November of 22. We've had some turnover and some new ones, but Liz, of course, is our supervisor. Cynthia Vela is another navigator. She's based in the Houston area. Myself, Carolyn Rodriguez. Carolyn is based in San Antonio. Keely Tani, she is in, I think, Waco. Don't quote me on that. And she covers the Austin area, as well as Carolyn Keeley and then Alexis McBride. They all cover the Metroplex region because there are so many applications that come in there. Cynthia does Houston and Corpus. Jacqueline Vera is specialized. She does our listed apps, and most of those come from our unregulated operations unit. That is the unit that gets and looks for people who are advertising for childcare who do not have a permit. They reach out to them and try to work with them to get them regulated. And then Samantha Mays, she also covers the Houston area as well as Region 5, which is primarily Beaumont. Next slide, please. As far as the navigators, what we do is we partner with applicants and assist them during the application process. I have actually worked for child care regulation, with CCO back in the day, since 1996. So I was 16 years in the field with daycare, doing investigations as well as monitoring. Then I moved over to residential for a quick few years, and then I moved into a state office job of risk analyst before I retired in 2018. So I understand the application process and how it can sometimes be quite onerous for applicants. We find this especially true with those people that the unregulated operations unit identify as operating without a permit. It's amazing how much false information is still out there in the public and on the internet. They'll go out, talk to them, and they'll go, oh, well, I read that in Texas, you don't have to have a permit if you're only keeping 3 kids or less. Yeah, that was true pre-2000. It's no longer true now. And so people are surprised at that because they've done a Google search, they found some site, and that's what it's told them. And despite our best efforts, we cannot get that information, that incorrect information, off the web. We've also found that care.com doesn't bother to notify people if they're keeping kids that they need to check with their state regulations. So sometimes that's another source where the unregulated operations unit finds people who need to be regulated. But then we also just work with people who decide to open a home-based childcare business, whether it's registered or licensed, and then those, of course, wanting to open childcare centers. Big part of our job is resource identification and coordination, because monitoring inspectors especially are just in the field probably 85% of the time. They just do not have the time to actively research, identify, and keep up with all of the community resources that are available to people out in the world. And so that's one of our primary primary task. We also collaborate with the CCR monitoring inspectors towards issuance efforts. That can include just speaking with applicants, helping them get their application stuff in, but also helping them navigate other things like signing up with child care services, food program, etc. Next slide, please. This is just kind of a timeline of what the navigator's job really entails. Anytime an application is submitted to child care regulation, it is of course put into our database, and that report is run daily for all of our applications, and then they are assigned to a navigator. We reach out to applicants. We should change that. It's not 10 days anymore. We've changed it recently to 5 days to provide the application process, discuss it with them, discuss the timeline for getting their permit, and also to provide resources. We follow up with applicants within 30 days to check in and provide any necessary assistance to help guide them. That doesn't mean we don't necessarily have contact with them. If they reach out to us, we answer any questions that they have. One of the main things that we tell applicants is that we are much more available to them to answer questions and anything than the inspectors are. So shoot us a text, shoot us an email, we'll get back to you as soon as possible. And then once they're issued, we send congratulatory issuance email that has additional resources for their continued support and success. Next slide, please. This is kind of an example of our initial contact. I will tell you that this presentation, we developed it with the intent, and we do provide it to child care regulation staff. So some of this, y'all may be looking at it going, I have no idea what that means. That's okay. CLASS is our CCR database. That's where everything is housed as far as applications, permits, CCR staff's documentation, things of that nature. This is just kind of an example of what we do. We do call the provider first. Whether they answer or not, it's kind of a 50-50 proposition. I have found that the more spam emails, I mean spam calls I'm getting on my personal phone is lessening the likelihood that applicants answer on their first call. And I understand that because I have my iPhone set up where if I don't know your number, it doesn't ring through. It just goes straight to voicemail. So we think that's sometimes what's happened. So we always give them an opportunity to please call us back. We'll discuss anything you want. And then we follow up that attempted phone call with an email that includes a lot of helpful information. Sometimes we've had to parse it back because it wouldn't go through because there's too many attachments and things of that nature. As I said, the applicants, we offer them contact either through phone call, texting our work cell phones, or through email, and we get back to them. We usually try to get back to them within the same day. Next slide, please. Some of the initial resources that we provide to them, of course, are a lot of CCR focused, our website, portal links, and the provider portal manual for them. The reason we send the manual is because CCR staff don't actually know what the provider portal looks like. They don't give us access to that because we don't need it, frankly. So one of the things about the manual is that they do have screenshots to help providers walk them through the different aspects of it, but also the IT help desk phone number and their hours are included in that manual so that they do have any problems, they can just contact the help desk rather than trying to contact CCR staff first and then get to the help desk. We offer steps to becoming a child care business, minimum standards, various checklists, and visual aids. We also send background check information, such as understanding the background checks, the timeline, and if needed, background check out of state information. I don't know if many of y'all are aware that if someone has lived out of state within the last 5 years, in addition to the fingerprints being submitted, they have to request an out-of-state abuse and neglect history. That out-of-state background check information, we have a little job aid that we use that lists all the states, the 49 other states, and I think includes Puerto Rico, and includes information on how they can request this. Now, some states don't have a way to do that, but they're very few and far between. Most of them, there are ways to do it. Some are a lot faster than others, but they do have to request that. Training, we send out a list of required training. I'm not sure if any of y'all are aware, but when you become a home-based provider, especially for registered homes, there are some specific topics that they're required to get trainings in when they submit their application before CCR can accept it. It includes stuff like safe sleep, transportation safety, if they're going to provide transportation, and many other topics. We also include CCR training and resources, links to TextPeds, CLI and Exchange, AgriLife Extension, American Heart Association, more than we could possibly list in those little boxes. But we send them out a lot. And a lot of that is not just to help them through the application process, but also to help them as they're going forward to make sure that they're maintaining their annual training and staff's annual training if they have staff. And then, of course, support services. We provide them with the information for their local workforce board so that they'll have an actual contact that they can contact without having to go to the Workforce Commission website and try to dig through that to find who they need to contact locally. We also give them the Square Mills website from the Texas State Department of Agriculture. That is the food program. If we are aware of local food program sponsors that serve their area, I also send them that contact information because it just makes it easier. We do research and provide them with grant options as we find them available. When we first started, of course, there was a lot of grants available coming out of the pandemic funds. Those, of course, have slowly dried up. So, but we are still finding some grants that are quite helpful, including several that are completely focused on female-owned businesses. So that is something that we send them. We send them information on Texas Rising Star, as well as Texas School Ready. And in our discussions with them, when we talk to them, if there are other things that we identify, like say there's someone wanting to open a center and they're wanting to have some sort of online attendance, record keeping, all that kind of things, we can put them in touch with some organizations that provide those as well. Next slide, please. As I mentioned earlier, at about 30 days after the application is received, we do check in, especially for those that we have not had contact with, just to check to see if they need anything. At the 30-day, most of the time, their application has either been returned to them because it's lacking information. And in that case, we'll reach out and see if they need any assistance getting anything submitted to the inspector that they've missed. Or if it's been accepted, we'll reach out to ask if they need any help preparing for their application inspection. And that's about it. So the follow-up contacts really are more focused. We try to focus on more getting them what they need to either get their application accepted or getting the information so that they're prepared for the application inspection to hopefully to lessen the number of deficiencies they might be cited at that inspection. Next, speaking of ProCare, Kangaroo Time, all of those things, those are some of the management software that we do have available to send out. Next slide, please. Oh, I should also mention, we don't have it on there, but since TWC launched the Texas Family Child Care Network, we do send that link out as well. Was a little disappointed a month or so ago to find that they hadn't got their micro grant section up yet, because that was one thing we were really hoping to provide home applicants, because one of the issues, especially with listed homes, is they sometimes find it that they can't afford to have everyone's in the household's fingerprints submitted. And I don't know if everyone is aware, but in addition to the applicant, the provider, and their spouse, anyone that is 14 years of age or older that lives within the home or visits frequently has to have a complete background check, including fingerprints. So that's about $35 a pop for everyone. And so we were hoping, that those micro grants would help assist in that area. In addition, some of the required trainings that registered homes are required to get are not always free. And so that was one of the things we do it. But we are really pushing the Texas I can never say this, TFCCN, to try to get it. I think it's a great idea because it offers them business coaching, mentorship, and just a way for home providers to have a contact with other home providers. I don't know if most of y'all are aware, but home providers is one of the most isolating careers that you can have. You're most of the time spend your day 12 to 14 hours a day with only little people. Whereas a lot of people love that. Sometimes it's nice to have another adult to talk to that's not a family member. As an aside, I am finding that as well since I work at home all the time. It's like I need to make more friends. I have some people to talk to that are adults and not applicants. Anyway, once the permit is issued by the monitoring inspector, we do check back periodically. I don't know if you're aware, once the application has been accepted, CCR has to either accept or deny or talk the applicant into withdrawing an application within 60 days. That is our legislative mandate in law. So we go back and check it frequently. And once there is an issuance, we send them an email basically congratulating them on obtaining their permit. And again, we send additional resources out at that time. Some of it's stuff we've already sent, but we send again, such as WorkSource Solutions, contact info, CCS, Texas Rising Star, food program. We also send out some marketing items and things like that, just to help them succeed in getting their business up and going. We also send them a navigator follow-up survey during this issuance email because we kind of just want to track and see what the applicants we've had contact with, what they considered helpful to them and what they didn't, so we can continually adjust what we're doing to get the greatest benefit of it. Next slide, please. This really doesn't apply to y'all. This is more for the inspector, so we can go ahead and skip this.
Okay.
One of the things, like I said, when we first started, we had a grant from Texas Workforce Commission. And then at about a year and a half in, those grants ended and we got another grant. Was also through Texas Workforce Commission, but it was from a different pot. And so we were overseen by someone else. And so our boss at state office ran a report and sent them this report, and they were shocked that we were actually tracking this. And from a CCR point of view, we're like, well, why wouldn't we track it? This is what we're here for. And this is the percent of applicants who have received a permit. The blue line is those that did not receive any navigator support, and the orange line are those that did. The only outlier in this is the licensed child care homes, or the LCCHs. And a lot of times that's because people, when they go online to submit an e-application through our website, often choose licensed child care home, not realizing that those have additional qualifications for the primary caregiver. And a lot of times people don't qualify. So what they do is they will withdraw that LCCH application, turn around and apply for an RCCH application, of which they do qualify. So that number we kind of give it a caveat. But these numbers are from late 2023 and early 24, or they may be more updated for that. I need to clarify that with whoever ran the report. But as you can see, we have seen a definite good outcome as far as those applicants that we have actually had contact with. And so you'll notice that listed homes aren't on here. We just recently started contacting them probably about 6 to 9 months ago. So we'll have to wait till we get a full year under that contact to see if we have indeed increased those numbers as well. As we all know, most of the areas of the state have child care capacity issues. And so we're really happy to try to work with people to get their operations up and running so that we can make sure that parents and, have childcare available so that they can work and contribute to our economy. Next slide, please. Okay, does anyone have any questions that Mike can answer?
Okay, I have a question.
Okay.
Okay, so once they decide to become registered, they're assigned a navigator?
Yes. Every application that comes in to CCR is assigned a navigator, and we reach out to those applicants within 5 days. Like I said, we try to call initially, and then if even if we're unsuccessful with the phone call, we do follow up with an email in which we send lots of resources. So if you know of anyone that has applied and has, when you mention the navigator and they're like, "Oh, I haven't heard of them," ask them to check their spam or junk email, because we all know sometimes when you get emails from somebody initially, it goes there. So, one thing I will add, just to toot our own horn, I guess, is that a couple of legislators last spring got a hold of our report showing the increase in permits when they had navigator contract and asked to meet with our program director. She was like, legislators are wanting to meet with me. I'm not too sure about that, but we were like, oh no, this is a good thing, because as we all know, if you want full-time positions and money to go to your agency, you need the legislators to know what you're doing. So we were really happy about that. Any other questions? Well, if you'll go to the next slide. I know that y'all are primarily all in, I guess, the Longview area. Is that where y'all are at? I'm not real sure.
We're like, yeah, Region 9 area.
For the
So-
Educational Service Center, right?
Yes, yes.
Yeah. Every state agency numbers their regions differently. It's very annoying.
Wichita Falls.
It is hard to keep up with. Yes.
Yeah, it's very hard to keep up with. So anyway, for HHS CCR, Wichita Falls and everybody is Region 2. So that's what we're under. So I cover 1, 2, 4, 9, and 10. As I said, it's mostly the rural parts of the state. And these are the other navigators in the areas that they cover. 3 is Metroplex area. 7 is Austin area. 6 is Houston. And 8 is San Antonio.
Awesome.
And then, of course, Jacqueline is the listed homes. If y'all know of anyone who, like, I know sometimes that listed providers, even if they're, let me back up. Relatives can get CCS if they're providing care for related children and don't necessarily need a listed permit. But if they, decide maybe they want to keep someone else's kid, 1 or 2 of them, Jacqueline is the one that would reach out when they do that application.
And that's for all regions?
Yes, she does the entire state.
That is good to know. I will definitely write that down. Oh, I have the presentation. What I can do, I know I'm not supposed to share the presentation, but can I share like all the contact information and everything?
Yes.
Okay.
This page you can certainly share with anybody who would like it.
Okay, perfect.
Okay.
All right. Does anybody
thank
have
y'all.
any other questions for Rhonda? Well, Rhonda, I appreciate you very much for coming and joining this meeting and giving us all this information. I feel like it's very helpful, and I like that I have this list of contact information that I can have readily available for anybody that has questions. Since you do include us in your resources, I do appreciate that as well.
Oh, and one thing that I should add is that if y'all know of anyone that is wanting to open a childcare facility, matter of fact, I have a meeting on Thursday with someone from Midland, a church. We'd be happy to talk to them, to walk them through the licensing process, tell them, what they're going to need to look for as far as in a building or anything like that. No CCR staff can go out and evaluate a building, anything like that beforehand, but we will certainly try to help them out as much as possible to make the process a little smoother and faster.
Wonderful. Yeah. So y'all remember that. If anybody talks to you guys or you hear of anybody who wants to open a facility, please let me know so I can pass along that information. And I will make sure to share all this contact information with you all as well. So Rhonda, thank you so much again. Okay, I'm going to stop sharing my screen. We're going to move on real quick. The next thing I have on the agenda is Texas Rising Star and TX3C updates. Right now, I don't really have a whole lot of like update as far as TX3C goes. It's just a constant working motion. They're trying to work through, you know, all of the bugs within billing and payments. And our team is definitely working very hard as well to ensure that everything goes as smoothly as possible on a very bumpy road. So I'm just going to say that much. I'm going to open up for any providers who are on the call right now to ask any questions for our mentors so that we can have some information. I know that one of you in particular had some concerns from not only yourself, but also providers. So I'm going to, Chelsea, if you would like to ask any questions, I'm going to open that up to you now.
Sorry, I was trying to find the text thread.
You're fine.
So this is basically everyone kind of in our area, from Graham to Bowie, Jacksboro, kind of our little 380 stretch. So one of the providers in Jacksboro was, okay, I'll just go through this quickly. I don't really want to say her wording. Basically she was wondering, I'm sorry.
No, you're fine.
She was wondering why so much was being used for administrative when there's so many on the wait list.
Okay.
It's a different funding.
Okay.
Because unfortunately,
Yeah, it's a
That's what I kind of
So,
assumed that for
Yeah,
sure.
the different funding, we have without going into great details, there's a bucket for direct childcare, which is where our wait list come from. And then we have what's called a quality bucket, where the state issues us a certain number of money and then they tell us what and what we can't spend it on. We have to do a quality plan that gets approved through TWC, and that's what they tell us we can spend that bucket on. So that bucket is where the needs assessment comes from, which is a lot of the items and furniture and stuff like that that we provide to our providers. So it's just a different funding source.
That makes sense for sure. And then I should have just pulled up our email the way I worded it. I'm sorry.
oh, you're fine. Don't apologize.
I guess the next one was they were just wondering if there was a way to get like when the in care and when the start care, like even if it wasn't just like paper copies like it used to be, if they could, I mean, I know most of the time I'll get an email, especially when they start care, but it's like the ending care that we're all kind of struggling with. And then we don't realize until like a month later, we haven't been getting paid for a child, but they're still attending type thing.
So, that, I guess that's what you're kind of talking about, the recertification dates. So
Yes.
Tiffany is here with me. She actually emails each provider. Whenever she pulls a report, that's a recertification report. And when those children show up on that report, that their recertification date is coming in, she actually emails all of the providers their children and it says, is it 15 days prior?
Mm-hmm.
It's 15 days prior to their recertification date. And she tells them the name of the child, when their recertification,
And when their packet is due.
yeah, when their packet is due. And then if they don't turn in that packet, there's an end date that she tells them. So they do get email notifications. Something that we have we just started, I believe it was last week. We had a department meeting. And so I know the TX notices, which before they were called
They're the 20 or 2450s.
the 2450s, that is the notification that we send to our providers to tell them their eligibility dates. And so that has been a little confusing since we got the new system. And we're still trying to work out a lot of where that information is coming from on that notice. So what I've instructed them to do is going forward, we're gonna highlight their eligibility date, like when their care ends or they suspend or they're gonna transfer and that care ends, because that date can be a little confusing at the bottom. You know, at the top, it says a different date, which is their recertification date. So we're gonna highlight that we're also going to call the provider to make sure that they are aware that the date has changed and the care will end as of a specific date.
Okay. I think that'll help a lot of the older providers too, for
Yeah.
sure. And then I know this was another one for kind of, I hate to say this, but like the older providers, she was just wondering, like, was TechPeds something that is just required by TRS? Was that just y'all wanting to do that? Like, I guess which it doesn't bother me because we do a lot of digital things anyway. But she's saying basically like we have to keep our paper copies for state and then we have a completely different file for TRS. And so that just might be a personal thing for her. But I guess, I don't know. Sorry. I see Adele smiling.
That
I
one.
know how hard this has been for everybody, y'all.
So
Mark came off mute.
TechPeds is required
Okay.
Rising Star for the director. That's what's the required piece.
Okay.
For staff, that's one of those point-based measures, so it's still optional. However, TechPeds is coming for license. So I think that's really been the whole thing the whole time is it's coming. And I get it, because you are doing two separate things. Licensing is still on paper. But it is coming. And I've always said, I think until licensing is fully on board with TechPeds, it's not going to be a 100% sale. But yes, as far as TechPeds, it's required for you, like directors. That's the required piece. Although Linda, who's our TechPed specialist, tries her best to just get everybody on board.
Perfect.
But yes, that's the required part.
Okay, that makes sense. And then I guess the biggest issue was kind of the missing payments and stuff that we've all kind of been struggling with.
Yes, go ahead. No, you go
I mean,
ahead.
I don't know.
It is. It is.
I just
difficult.
like, is that system error or is that human error? I'm just kind of at this point.
It's a little bit of both, to be
Okay.
honest. There are a lot of updates that they update us with, and there's a lot of stuff in the system that they'll work through that just don't work. And it can be as simple as just like one thing that isn't submitted versus, another thing that's just not working system wise. Again, the system is not,
I have started a new process though, because a lot of it I was thinking was the system. And so I myself, as the program director, which billing is really not my thing, but I have jumped in and I've learned a lot of it because of the system issues for that very reason. Because I'm like, is it a system error or is it my staff? And so I have started a new process. We've never had to do it before because it worked in Twist. But with our new system, I am currently training 2 other people for our billing. And once they get trained, we will have a QA process where before that upload ever goes out, it's going to go through 2 other people to look and make sure they're going to do their due diligence, which goes into checking the child's schedule, checking the rates, checking to make sure that everything is paid correctly. And if we've already previously paid a provider, should we be paying them again, or should we be taking money back? So that whole process is a process. And so once those 2 other staff are fully trained, we will have a QA process. I know that's not exactly what they want to hear.
Yeah.
Because it's not an immediate fix, and I apologize for that. But we are working through those issues.
Okay. I appreciate that for sure.
I appreciate you being kind of the go-between person between providers and, everybody here, because if we didn't know what the issues were, we couldn't try our hardest on our end to fix it. And I promise you and assure you that our entire team is trying their absolute hardest to.
Oh, I definitely see it. And that's why, like I told you in the email, I really didn't want y'all to feel attacked at all, but It's just everybody knows I'm on this board, so they start messaging me, and then
Yep, the only thing that I
I'm like,
probably.
honestly, I would rather message me than call and cuss y'all out again. So I'm so
The
sorry
only thing
about
that I
that.
probably would like to ask of our providers is that they continuously, every time they get a payment proof, it is very, very important. And I know it's time consuming, and I know it's repeatedly the same people on there. But if there is a child that's on there that you are not getting paid correctly, I want to hear about it every single time
Okay.
until it gets fixed. So even if you guys feel like you've already told me, tell me again.
Yeah.
And Chelsea, this is Lisa McDaniel. And so I do want you to know that it's not necessarily isolated to just us either. It honestly, it is a statewide issue because of the system. I can tell you that this is a discussion that's being held at the state level, because I am the president of all of the executive directors across the state of Texas for our group. And we bring these issues and things to the state level continually. And so they're very aware at Texas Workforce Commission. They know that there's issues. The system is, for lack of better terms, it's flawed.
Wonky.
They know it's flawed, and they are, I'm trying to pick the correct words. At what point do we raise the white flag and say we give? But they do see the issues, and they've been able to work through a lot of these processes, but it is still a great concern because it's really affecting the livelihoods out there on the front line of the providers, how you can make ends meet, and they're very well aware of that. So again, when Kayla said that it's a full team effort, it truly really is. There's no easy fix. It would be nice if we could just click the switch and go back to the old system, and that's just not possible. So again, they're trying to work through this, and again, it's not, there's a lot of challenges, but the state is trying to work through those. And again, like Donna said, she has identified some internal issues that we really weren't aware of. So those are being addressed, and trying to rectify that at this moment too. So.
And again, the one thing that I have to say is that we've got y'all's backs. We know how incredibly hard it is to do everything that y'all do day in and day out. And goodness gracious. And I just want to say on behalf of myself and everybody, that works over here for you guys, that we appreciate you. We appreciate everybody that is, understanding and being patient. I know that it's really hard, especially whenever, again, like Lisa said, your livelihood is at stake. Whenever you're supposed to be getting paid, you're not getting paid, or you have to return funds, anything like that. But I think that with the right application and the way that we're going to be going now, that all of that is going to be taken care of. And Donna is like knocking it out of the park, making sure that all of this stuff is the way that it needs to be. We're communicating really well over here, and we're just kind of all in this together, like High School Musical. So we're trying our hardest, and I just want you to know that I appreciate you, and I appreciate you communicating with other providers. And of course, if you hear anything else from any other providers, please never hesitate to email me, because your concerns are our concerns, and I want to make sure that we are doing everything on our part to make your lives as easy as possible. Okay.
I will say the wish list, everyone is very, very thankful for those. So I know the one was asking about the wait list, but honestly, like just even us, like we're so thankful for the wish list items. And I mean, level 3 in Windthorst, we've got a 4-star, and
or Lance.
Yeah, and
Bryson.
then you're doing a phenomenal job out there too. And I know that, your mentors and everybody, y'all are all working extremely hard. And I really commend you. I commend you for what you do. And I'm very thankful for this team. And so I'm gonna have Donna answer your questions that are in the chat.
So as far as funding for providers, will you be contacted to make what you're calling a wish list? Yes and no. So the way that we're actually doing it is your mentor the classroom mentor, whether it's Michaela or Melissa, should come to you, whenever they're doing like your mentoring. And so if there's concerns or things that you want in your center, or if they notice something so everything that they're doing on our needs assessment is not simply a wish list. So it's not something that, oh, I just want this. It has to go towards our quality. It has to either raise your star or help you meet certain criteria of TRS. So whenever they're looking for stuff, they may notice something that, hey, they don't have multicultural items, or they need a rug, or whatever it may be. They'll bring that back to what we call a provider service liaison, and that person will do that. However, if you do have a wish list that you feel like your provider hasn't asked you, or your mentor hasn't came out and not assessed you, but what am I trying to say? If they haven't came out and made a wish list for you, and you want us to look at your wish list, I'd be more than happy to. If you want to send it to me, or if you want to send it to your mentor. However, I do want to make it a point that we don't get everything on your wish list, because if it doesn't go with the TRS standards, or it doesn't help the quality of your daycare, then 9 times out of 10, you're not going to get it. Is there funding available? Absolutely. We just started our new funding October 1st. So yes, there is funding available. What's the next question?
It's the
Is
wait
waiting
list.
list? Yeah, it's about a year now. It's not even 6 to 8 months. It's about a year long now. So we are in open enrollment, and we outreach 40. We outreach 40 clients a week. What that means is we send them a placement packet. So it's just up to however many send that back to us, and then that's how many we end up, possibly placing. So.
Does anybody else have any questions? I know we're almost at time, so I'm gonna check the room. Or does anybody have anything else that they want to add information wise to everything that we've discussed today? I feel like this was a really good discussion. We learned some stuff. We talked it out, and I'm looking forward to things getting better. You just kind of have to keep your head up. I'm going to keep my head up. I'm going to keep everybody's heads up, and we're just going to do what we do. And I will say that the next meeting time was going to be December-ish, which is going to be busy, busy, busy. I know all of us are extremely busy in December, so I may possibly keep that meeting to online only. I will give y'all more updates and details. Of course, I will be sending out any information that we talked about today. And if you guys have any questions, concerns, or anything in the meantime for the next time we meet, please email me or call me. And I appreciate every one of you. And I hope that y'all have a wonderful rest of your day. Thank you. And thank you, Rhonda, again.
Thank you, Kayla, for letting me present.
Absolutely. Thank you so much. I will see you all soon.